Aloha lele, greetings and big kia ora from the Cook Islands. Thank you very much to all our distinguished guests, friends from all the agencies, various agencies, the sponsors, Ministry of Health, the Government of Tonga, and the University of Auckland. Thank you for allowing us to attend this meeting. This is very informative for us, and it has opened up my mind and my eyes as well to what's happening in our region. Since I'm the first one for the afternoon, I thought I'd just keep it simple, let it flow, and hopefully finish in 5 minutes. So it won't take long. So just a bit of background. We were asked what priorities given to scabies and rheumatic heart disease. The Cook Islands, we take rheumatic fever, rheumatic heart disease very seriously. It's a very important key performance area in our new Cook Islands 5-year strategic plan that is coming up. We'll be releasing it at the end of this month. Every 5 years we have a strategic plan, so it helps us plan for the next 5 years. And one of the key components of it will be in rheumatic fever and rheumatic heart disease screening. Unfortunately, like everything that's been discussed this morning, not much priority is given to scabies, and it tends to be not given the priority it should. Maybe I'll be able to explain a bit more a bit later. So, Cook Islands use a national medical health information system known as Rheumatic. So we basically do our notes and type in our notes on this information system. Initially, the Rheumatic system was introduced to general practitioners in New Zealand. So for those of us that have worked in New Zealand, you probably might, especially in the private GP clinics, you probably know what I'm talking about. It started off with the Rheumatic 32 system. Now it's been upgraded to the new Rheumatic Evolution. So I just collected the data. I'm not a statistician, so I'm not sure if I'm completely correct, but I've collected some data over the last 5 years, and I was going to present a little graph, but I thought it would just be better just to get my information across verbally. So approximately 155 cases of confirmed rheumatic heart disease with a slightly high prominence in females, 58%, and we saw a higher number within the 2019 to 2021 years. We're still not 100% on the high-risk groups yet to be, so we're still trying to do a proper clean up of our data and try and make a better estimation of the high-risk groups. Over the last 3 years, however, we've seen a slight decrease in the numbers of cases. I'm not completely, I put a question mark at the end of that statement because I'm not completely sure whether that's 100% accurate due to the system that we're having and also the way that we call it classification. Classification by the clinicians are usually not 100%. So if it's done in the outer islands, it might not be correct or confirmation of a RHD case unless a specialist puts it in. So it's just around about cleaning up the information. Probably a better, robust number will come out after I've returned back to our. We were also asked to discuss national local initiatives that measure, monitor, or manage and prevent RHD, or rheumatic heart fever. The Cook Islands currently manage rheumatic heart disease through monthly prophylaxis with patients below 16 years being seen by pediatrics, and those above that age being seen in the general physician's office clinics or in primary health clinics around the Rarotonga or in the outer islands. Screening by echo is carried out either by chance. Maybe a specialist comes over and does a screening on their holiday or something like that. So we usually make use of that time to grab them and get them to do some work while they're on holiday. Otherwise, it's carried out 2 yearly. We do have one doctor in the Cook Islands that does the echoes, cardiac echoes, and he goes around the outer islands and also around on the main island. Patients with advanced heart conditions seen in special clinic usually seen 3 to 6 monthly. And if there's a need for further escalation of treatment, then we are usually sending them across to New Zealand. Positives. A trained person for echo screening with national visit around the islands every 2 years. Cases with serious cardiac issues transferred over to New Zealand for further management. This includes valvular heart replacements and so on. Problems. That trained person that we've trained, the echo screening, is retiring. So we have in place a succession plan. So we are a bit stuck in that situation, and as we all are having the same issues, we're having issues with retention of our staff. So the new staff, our new doctors, young doctors, staff, nursing staff, they're going for greener pastures. We cannot compete with the bigger countries. So unfortunately, we're going to get the drain. New Zealand's complaining that they're getting the drain, but the numbers are from the Pacific are actually going to New Zealand to cover that drain as well. So the islands are actually getting a drain as well of specialized and trained staff. Yes, the other thing is reliance on funding for national screening. We have, like all Pacific nations, a small budget for our health systems. So depending on the country, the amount spent by the government usually their GDP as a certain amounts used from the GDP. The Cook Islands one is unfortunately a bit on the low side. Around about 4% of our GDP is spent on health. So we're looking to increase that at some point. Reliance on specialist visits from outside the cooks to do the national screening. Fortunately, we have a good relationship with New Zealand, and we usually get specialists we call specialist visits or health specialist visits from New Zealand. We have a fund for that, and we get some help and some funding from New Zealand as a result of that. So that's how we do some of our screening processes, programs. Sorry. So now scabies and heart disease. Oh, sorry. Scabies and skin infection. So just taking that 5-year data, about 377 cases of scabies were found in the data I cleaned. Majority of the cases, about 60%, were below 16. Sorry, I didn't go lower than 60. It's just easier to use the system. But of course, it would probably be more prevalent in the younger generation below 9s, I guess. So, so far this year we've had 35 cases that have been classified. And over the last 3 years, it's actually been stable around about 40, with a bit of a spike in 2018. We had actually about 80 cases. Yes. So like what was mentioned earlier, a bigger priority is not given to scabies, and the high-risk group seems to be the under 16 age group, and the families, of course, of those affected people. In the cooks, most of the cases are just small outbreaks, so it's sort of seasonal. Usually around, this is just a generalization, usually around the high peak areas, like with the increase in tourism and the increase in families returning back from New Zealand. We find a bit of a spike after that time. So around the Christmas and the middle of the year, June, July, where we have celebrate our Constitution celebration, and of course the Christmas time. Yeah. So the Cookans, unfortunately, do not have much cases of crisis scabies, but tend to have some outbreaks of simple scabies within family groups. National initiatives are not a priority for scabies at this stage. It's younger generations of Cookans that tend to visit the health facilities frequently, because access to health centres and are quite good. So if children have if children have certain health ailments, usually a family member is quite quick to bring them in to be checked by a medical personnel. The older generation, however, is 50-50. They usually care more about their grandchildren more than themselves. So they'll probably bring their kids, their grandchildren for a checkup with scabies, but then we'll ask them, "Oh, do you have scabies too?" I'll say, "Oh, yes, I have. Oh, yeah, it's a bit itchy." So then we don't put much emphasis on themselves but meant more for their family members. Positives, it's relatively well controlled with permethrin. We have ivermectin, but it's available privately in our pharmacies, private pharmacies. Problems is proper assessment about that data needs to be done. Possible better look at the practices of our staff and see how much they're actually getting the diagnosis right and how many of our people are getting misdiagnosed, like what was mentioned earlier, with some cases just being treated for maybe impetigo, but then the underlying issue is the scabies. So that's something for the guidance to look at. So that was good about that presentation this morning. Yeah, that's something that I'm going to be taking back. So we did have an outbreak of hand, foot and mouth earlier this year, which was noted in our school children, preschoolers. So that was good to get that sorted. So we dealt with that. Took about a month to get that. So that's one of the beauties of having a small population like the Gardens. And I think doing the medication, MDA, sorry. Doing the MDA class will probably be a good idea. We can get it to our whole population. So at the moment, we have not seriously investigated possible links between RSD and scabies, but will likely be addressed at some point by our country, especially when they return. We will make comparisons from our neighbouring, so it'll be interesting to listen to the views of our neighbouring islands, just to see what their data is like as well, before we make any serious commitments like any MDAs. More training needed for echo screening. It's one of the negatives, and possibly more emphasis on maybe, I'm not sure about that throat swab, but I wrote this before I heard the presentation this morning. Or strep throat, maybe for high-risk groups in the community. And probably better understanding of the scabies, especially in diagnosing scabies. Otherwise, that's our little presentation for guys. Thank you. Minta ki mata and malo people.